It is 9 o'clock sharp, and we welcome you each and all to this forward-thinking and meant to empower gathering. So each of you here are demonstrating by your attendance today at this Impact Collaborative that you are, as an audience, thought leaders in our community, ready to go out and make your own impact. So whether you are listening or speaking today, you are that leading edge that shows up, prepared to focus on critical issues facing women and girls in our community. This, your Women's Fund, intends this to be an interactive, proactive, and tool-providing village square where we meet the first Thursday of each month to share information and tools that we can wield to uplift ourselves and one another. So who's with us here today? Fabulous RSVP list, amazing. Can't mention everyone, but we will say we have many of our fabulous board members and our staff, sponsors who have committed to support our mission, like the sponsor of this series, the Miami Dolphins Football Unites. Also, the Greater Miami Convention and Visitors Bureau, Citrus Health, who are helping to sponsor our very powerful and high-impact summer domestic violence campaign in these critical times of COVID-19. And we did get a report yesterday. I was on a special meeting with the Miami-Dade Commission for Women, and there was a report from Yvonne Mesa saying that now people are starting to show up more often and come for services again. It's very important, very important. So thank you all for supporting this campaign, and you can still support. So if anybody wants to donate, please come to our website because we'd like to continue this campaign as long as possible. And we also have Kaufman and Rawson, who are the sponsors of our August Equal Pay Awareness Campaign. We have representatives from the offices of Commissioner, the Miami-Dade Commission for Women, many first responders and victim advocates who we are especially grateful to in times of this pandemic, and many, many more. We thank our committed major donors who are here side by side with grassroots contributors. And each of you are investing in your belief in our organization and that when women are strong, the world is strong. And a very special welcome to the Clio Institute. We'll be speaking about them a little bit later. And now for our keynote. Is my personal and professional privilege to welcome a global expert in the atmospheric sciences, specialized in the study of climate change, and one of Miami's stellar community leaders on the subject, Dr. Amy Clement.
Thank you, Maria, and good morning, everyone. It's a real pleasure to be here, and I want to thank the Women's Fund for inviting me to give a keynote, and also for all the work you've done over these many years. It's so important in our South Florida region. Thank you. So I will start with the big picture. So if we can advance to the next slide. This is a movie of the surface temperature of the planet, starting in the late 1800s and going through to today. And the years are shown here on the bottom. The warm colors show, the red colors indicate warming, which you will see becoming global, especially in the last several decades. Maybe we can play that one more time to get, oh, if you can go back and play that one more time, you can see, you see this steady warming until today. This warming is caused mainly by human activity, mainly burning oil and gas, which puts greenhouse gases into the atmosphere and warms the planet. Unfortunately, the world is not turning off the burner underneath this warming. And in the next slide, I'm going to show you the kind of work that we've been doing to show us what's coming. The warming that you saw in the last video is just a preview of what we'll see in the future. In my lab at the University of Miami and in other labs around the world, we use computer models. They're much like weather models to make forecasts of the future. We can show the difference if we do business as usual, which is the red line here, which shows us a steady warming in the next decades and extreme warming by the end of the 21st century. If we transition quickly to a non-carbon based energy sources, that's the blue line here, and you can see it makes a difference, a big difference, especially at the end of the century. But either way, we will see warming. that has been set into motion by accumulated greenhouse gases in the atmosphere. We need to be informed about this, we need to be prepared about this, and we need to act. Next slide, please. What does this mean for Miami, and specifically for women and families in Miami? You'll hear more about this from the talented experts on this panel, but I'd like to set the stage a bit more for what we're expecting. In addition to the hotter temperatures that you saw in the last two slides, this also means, the warming also means that the sea level is going to rise. This image comes from the Southeast Florida Regional Climate Compact, which was started in 2010. The 4 counties of South Florida came together to agree on a set of guiding principles that would inform decisions about relating to climate change in South Florida. And this is a picture, much like the last one you saw, of a timeline of the forecasts of sea level rise here in Miami. So if what you see is that, this was recently updated and just came out in January 2020. What you see is that we can expect sea level rise. We're not exactly sure how quickly the sea level will rise, but we know we can expect somewhere in the next coming decades of between 10 and 17 inches of sea level rise. Now, it can be very difficult to think about what that means for anyone here on the ground. And the next slide is going to give you, now I'm going to start to talk a little bit about what that might mean for us. This is a picture from one day in September 2017. What you see is 3 hurricanes here, Katia, Irma, and Jose. We all know about the impacts of Irma here. It was preceded by Harvey and followed by Maria, all in that same year. Research in my lab has shown that we should expect to see storm activity like this for the foreseeable future. We do not expect to see decreases in storm activity. Although we cannot predict exactly when and where more than a week in advance a storm will hit, and we also can't tell exactly how many storms will hit in the US in any given season, we do know that the impacts will be worsened in a warmer world. A warmer atmosphere brings more rain, a higher sea level brings more storm surge, and we've already seen both of these things play out in the storms in the past years, and I expect we'll be seeing that this season as well. Next slide, please. The risks of heat and storm surge and flooding are not spread evenly, even within a city like Miami that tends to be described as flat. In fact, some parts of Miami are much more vulnerable than others. This is a map of on the left-hand side is a map of the city. And on the right-hand side is a map of the elevation of the ground in the city. Now, again, we see Miami's totally flat, right? No, it's not. We see that these red areas are actually areas of high elevation, which are up to 18 feet above sea level. In fact, the highest point in Miami is right underneath the Brickell Metro stop, which you can see, maybe somebody can point to there, yeah. So the risks of flooding are not spread evenly. And one of the things that we actually see is that you can see that there are inlets of water in between these red high stands, which mean that flooding impacts can come way inland and storm surge impacts as well. In a team of researchers at a group of faculty at the University of Miami from geology, architecture, communications, the library, and policy, together with Catalyst Miami, Myra is on the call, you'll hear more from later, and Clio and the City of Miami and Miami-Dade County, we are working to map hyperlocal risks, and we're working with the community in order to drive solutions that are tailored to the risks of these different areas. So let's dive in a little bit deeper on the next slide and go to a part of actually, if you can go back, Viviana, sorry. I'm gonna focus on this box here in the upper right. This is an area around Little River, which is, you can see that there's a certain amount of elevation difference there. There are high stands and low stands with a river, actually that originally connected the Everglades to Biscayne Bay. So next slide. So we'll hear more about heat and hurricanes, things you can see and experience right here at the surface of Miami. But there are also issues that are happening under our feet in ways we can't see but have big impacts. This is a picture from our work in this University of Miami team, which is has its it's a group called hyperlocal responses to climate adaptation. And what you see is the colors indicate flooding from storm surge. These light colors indicate water coming in with storms. And what you can see is that first, storm surge is not just a coastal issue. It impacts communities well inland from the coast. And you can see, Viviana, if you can kind of highlight this area, yeah, the inland. Now, what is shown on top of that, the dots, are actually septic tanks. There are large parts of the city that are not connected to sewer. And as we know, as water comes in from the sea, it makes septic tanks basically inoperative. And it means that the groundwater can be significantly contaminated with sewage. This is not just a coastal issue. This can affect the quality of our water, both in our drinking water, in our parks, in our beaches, and all the public spaces that we rely on, not only for recreation, but also for the mitigation of stormwater. Next slide. If we add, it's easy to imagine that if you add layers of social inequality to this map, you can see even higher levels of risk. This is a map that shows access to central air conditioning. Bluer colors mean more central air conditioning, and lighter colors mean less. And I know, I think we'll hear more about the disparate impacts of heat across the city, but what you can imagine here is that if you compound risks associated with flooding, heat, lack of AC, add a pandemic, that we have very significant risks that are inequitably distributed across our city. And so investing in climate adaptation in the most vulnerable communities right now is critical and will save lives in the future. Next slide. So what are your local governments doing? You will hear more about this from Alyssa Farina, who works for the city of Miami. Over the past 3 years, the governments, the Miami-Dade County, City of Miami, and City of Miami Beach have worked together to come up with a strategy for making a more resilient Miami. It's called Resilient 305. And there's a number of actions that are focused not just on infrastructure and building a resilient infrastructure, but on people, jobs, and transportation. And we've built a research collaborative around this with FIU, and Miami-Dade College to support this effort and ensure that community-driven and equitable outcomes. Shareholders on that team as well, and you may hear more about this from Alyssa as well. So the last slide here, I'll just start with a personal note that I'd been working, as you saw from my earlier slides, on the theory of climate change. Why is it happening? What will happen in the future? And kind of this global picture. And I got more involved locally in the last several years. Let's just say it started in November 2016. It also coincided for those working parents at a time when my kids started to become more independent. I could take on more personal action in this space beyond what my day job entailed. So been making progress in South Florida, thanks to many of the people on this call. And it really takes partnerships. And what you see here is a collection of different groups that are working together in order to make change here. What can you do about it? Well, first of all, I think it's clear that we need structural change in how we produce energy. And that has to come in lots of different ways. One, it comes from collective action. Individuals' choices are ultimately are ultimately the cause of this. So if we can all make choices to reduce our consumption and reduce our emissions, for those that can make choices, that it's incumbent upon them to do that. We also need to advocate for federal, state, and local policies and elect politicians that are supportive of change. I'll call your attention in particular to the Citizens Climate Lobby, and they have a lot of individual action related to specific legislation on reducing greenhouse gas emissions. You can also get informed. One way to do this, I've highlighted, is our Climate Resilience Committee, which meets the first Monday of every month. We're a board that advises the city of Miami on issues related to climate resilience. And there's a lot of extremely informative presentations at those meetings every month, including an opportunity for public comment, which can be made either voicemail or online. All our meetings are on Zoom now, so they should be easily accessible to people. And finally, I would say get involved. There are a number of groups, several of which are highlighted here. Some are represented on the call, and I think you'll hear more later in later presentations, of groups involved in advocating for policies that are fair across different groups and protect our city and prepare us for the coming climate changes. And with that, I'll just say thank you to everyone. It's a pleasure to be here, and I really look forward to hearing the next panelists speak.
Thank you so much, Dr. Clement, for paving the way for us. And now I'm going to give some housekeeping, how this is going to work. So our amazing staff, Viviana Alvarado Pacheco and Carolina Garcia, are working hard behind the scenes. We do gather normally in person, and we whiteboard after the panel presentations. And we do take each group puts together 3 key issues that they identify as being important and 3 key solutions. They can be large, they can be small, they can be collaborative, they can be simple, good ideas. No idea is silly, no idea is too large or too small. We ask you to please post those during the chat. We do collect them, they do inform our policy moving forward, and we do share them with other organizations. So please, please participate and do it. Every single attendee. Thank you so much in advance for that. And then the Q&A, we'll get to as many questions as we can. That's a separate tab. So you can see at the left is the chat, at the right is the Q&A here on your screen. Please post your questions there and we'll get them to the panel at the end. And then I will remind you more than once that we do have an exit survey. As soon as you're done here, it does make a difference to us, and those comments are gold. So it's not only the very, very brief survey, but also please leave your comments. We need quotable quotes, and those do help us as we move forward. So thanks for your participation. And now, focus again. We're here for the Women's Fund Miami-Dade because we do look at things with a gender lens, because when we look at them with a gender lens, we see differences that then contribute to uplift all of society when we treat things as they should be seen. Knowledge is power, and women are disproportionately affected by climate change. According to the United Nations Secretary General, the global threat of climate change and environmental degradation is poised to exacerbate the already increasing number of complex emergencies, which do disproportionately affect women and girls. And also from the UN, the power dynamics and societal expectations that define roles, responsibilities, behaviors, and differential access to, use, and ownership of resources, such as land, livestock, or other financial assets for people with different identities, help shape how people experience and manage risk in the context of climate change and insecurity. The connection between climate change and gender is also about ensuring that women play crucial roles in setting the international agenda on climate change. Addressing gender gaps and more effectively engaging women, like we are today, has the transformative potential to generate greater results for the global environment. Will support women's roles that can change the causal chain of environmental degradation, including their involvement in public and private sector governments, their role in productive sectors, and their choices as consumers in the global market and the investment choices they make. So with that, we will ask each of our brilliant panelists to, in just 2 minutes, and we could have each of them here for hours and be enthralled, introduce themselves in context of today's topic. Dr. Holder, so thrilled to have you with us. And we need to unmute you and welcome you.
Hi, good morning, and it's a pleasure to be here with such wonderful panelists and the audience and talking about women. I am an associate professor at the College of Medicine, Herbert Wertheim College of Medicine at FIU, and I'm an internist by training. And my area have always been working in our communities along Miami-Dade County, the less vulnerable communities, more vulnerable communities. There's so many changing terminologies now, but it's really the folks who are uninsured, underinsured, usually the Black and brown people that come to Jackson Memorial Hospital and all the federally qualified hospitals and centers throughout Dade County, and trying to improve their health outcomes and looking at what we call the social determinants of health. So where you live, where you work, where you play, where you worship, with your access to money, power, that's what we look at as we incorporate those understandings in how that impacts a person's health. And we know for women, as Maria just explained clearly, was all about the social determinants of health that makes women so much more vulnerable with climate change. Thank you.
Perfect. Thank you, Dr. Holder. And thank you everyone for putting this together. It's really exciting to really talk about these issues and how they impact women. So important, something we don't often talk about. My name is Mayra Cruz. I'm the Climate Resilience Program Manager with Catalyst Miami. Just a quick background about me. I actually come from a public health background. That's what I did my undergrad degree in. And then I received my master's of public health and environmental sciences and focused on the intersection of climate and health. So I'm always excited to talk about these issues because that's really what I focus a lot of my work in the last few years, especially here in Miami. So with Catalyst Miami, we're an anti-poverty nonprofit, and we just work to improve the health and well-being of low middle income families here in Miami-Dade County. So for me, what that looks like as the Climate Resilience Program Manager is ensuring that our community members, especially those that are most impacted and unfairly by these impacts of climate change, are aware about these issues, that they're educated, and that they have the tools to advocate for the solutions and policies that they know will work best for their communities. Instead of having outside experts coming in, I think it's really important to uplift the lived experiences of our community members and have them really drive the solutions that will make Miami a more resilient and better place to live in for everyone. So I'm really happy to be here. I'll definitely talk more about what that looks like in practice, but I think this is such an important issue and I'm really thankful to be a part of this panel today. Thank you.
Thank you so much. Sky Wheeler.
Thank you very much. So honored to be on this panel. Really amazing group of people. So yeah, my name is Sky and I am a senior researcher with the Women's Rights Division at Human Rights Watch. Human Rights Watch is an international NGO. We don't take any government funding and we investigate and reveal human rights abuses in about 50 different countries around the world. And I have about 500 colleagues. I'm the crisis researcher within the Women's Rights Division. So that has meant historically a lot of work in political crises and in conflict situations. So I spent most of the last 10 years working on rape in sexual violence in conflict and denial and obstruction of reproductive health care within other crises. About a year ago, I was asked to shift over to work on the climate crisis. And this was because of the massive scale of the climate crisis, but also because, as everyone on this webinar is painfully aware, we've seen a real lack of government action to address the climate crisis. We could have worked anywhere, I could have worked anywhere in the world, but I decided to work in the US, and that's both because the US is a very significant carbon emitter, but also the home to hundreds and hundreds of thousands, millions of climate crisis victims as well. And we already know from decades of working in many different crises of different types all around the world that the needs of women and girls will be marginalized. And from working in the US, especially in terms of reproductive health care. We know that in the US, that marginalization, race will be a leading factor in that marginalization. So my research has been looking at the impact of heat on pregnancy and birth outcomes. Heat is often called the silent killer, but as I'll talk about in my presentation, pregnancy is even more invisibilized even within that. Thank you.
Thank you so much. And now Alyssa Farina.
Hi, good morning. My name is Alyssa Farina. I am a Resilience Programs Manager for the City of Miami Office of Resilience and Sustainability. So I want to talk about myself a little personally quickly. Is I moved to Miami in 2010 to attend University of Miami, where I got a bachelor's degree in ecosystem science and policy. And over the past 10 years, it's been really interesting to be witness to the increasing consciousness and awareness of climate change here. You know, it wasn't really a conversation. We weren't really in the news about it. And now it's a really present conversation and a really present part of daily life here in Miami. So that's been really interesting for me. So in my role as Resilience Programs Manager for City of Miami, I focus a lot on carbon mitigation, sustainability, and to my pleasure, community engagement. We have many, you know, Amy touched on them before, of great climate advocacy groups here in Miami, like Catalyst Miami. And it's really important for the city to work together with these groups on climate action. So that's part of the work that I do. And a lot of it is just to motivate and push forward programs that can help individuals become more resilient to climate change and to help culture change, you know, city processes and protocols to integrate the climate threat. So it's not just, you know, climate in one little box over here. We're thinking about climate across programs that the City of Miami and services that the City of Miami offers. So thank you for having me on the panel today.
Thank you all so much. I'm really excited. So now each expert is going to take about 3 minutes to focus us on key issues that they're identifying in the context of today's webinar. Dr. Holder.
Yeah, my first slide. Oh, I hope you can see it closely. But when we go look at climate change as a problem, how is it harming our health? And what makes us more vulnerable? How are women different? And if you look, climate impacts us really in 4 major ways. There's a direct impact. You have the heat, you have air pollution, you have extreme weather. Then these all lead to increase in the vectors, and we're hearing about West Nile, we're hearing about Zika, dengue. You get contaminated water. We just heard about the septic tanks. You get contaminated food, there's disruption in food supply, and there's a disruption of the emotional well-being, which we often overlook, the mental health issues that comes from this constant stress. And we use heat wave as a way to just remember the major illnesses that happens. Heat illness, worsening of your heart and lung condition, asthma, traumatic injuries, water and foodborne illnesses, allergies, vector-borne diseases, and emotional stress. So when we think of women, what is different about women? We know physiologically the reproduction, and Sky Wheel already talked about what you'll hear more on the reproductive issues that heat has. And then you think about is there any physiologic difference how we respond? One of the major differences between men and women, of course, is around menopause. And that area, heat impacts with menopause affects our sleep, which then leads to all the other long-term effects from disrupted sleep. Because to sleep, you need about 73 degrees at nighttime. And so nighttime temperatures become crucial for the menopausal woman. And also, when the rates of obesity, which is more in women, the heat dissipation mechanism is a little bit worse, so they feel heat, which will put you at more risk for heat illnesses like heat stroke and heat rashes and all the complaints. But when you look at the basic issue, heart and lung disease, asthma, waterborne illnesses, there's really no difference in genders, but what we look at is the differences in the social determinants of health. And that's where the problem of the disparities that's already in existence that happens with women and especially Black and brown women plays. And so the impact of climate change is already felt in Miami and all the poor communities in Florida and around the US and around the world. And the heat and climate change amplifies and accelerates these disparities, just like we saw in COVID-19 in the pandemic, where Black and brown people were dying at much higher rates. It's the same issues that we're dealing with the climate crisis, that these impacts, because our social determinants of health, where we live in poorer housing, we live closer to highways, we live closer to power plants as poorer people, we live closer to all the exhaust, all the poor septic conditions. That then increases your risk of getting these diarrheal illnesses, the lung problems, exacerbation of the heart and lung disease, the heart attacks, and we see the impact more. So again, we have to look at the social determinants of health, all the factors, what's going on where we live, how do we address those disparities if we're going to help our women. But physiologically, our gender differences are not significant other than on the reproductive end. But our social determinants is what is driving our poor health outcomes, especially for Black and brown women. Thank you.
Thank you so much, Dr. Holder. Mayra Cruz.
Thank you, everyone, and thank you, Dr. Holder. I always love being on panels with you because I always learn things every single time. It's always an honor to be here with all of you. So yeah, as my role with Catalyst as the Climate Resilience Program Manager, I do oversee a program called CLEAR, Community Leadership on the Environment and Resilience and Advocacy. And it's a really powerful program where over 10 weeks we do talk about all of these issues. And one of the sessions, we particularly do talk about the public health impacts, and we always start the presentation talking about health disparities and talking about social determinants of health. And one example that we often use is how, for example, Serena Williams, when she was giving birth, she had some complications. And it was this really interesting snapshot of what Black women tend to go through when, they're at the doctor's office. There's this bias that happens sometimes, and it gets to what Dr. Holder was talking about before, when your race and ethnicity can play such a big role in the type of care that you receive. So I like starting with that example because it really shows how sometimes there's things that are out of your control, and for that reason you end up being impacted in severe ways. But along those same lines, there's also been powerful research done around Hurricane Katrina, for example, where women who were in precarious situations in their homes that were dealing with domestic violence, especially during those times where we're dealing with hurricanes and there's disruption, women who are in these positions tend to have, they just tend to go under the radar. No one knows what's happening with them. With the coronavirus, that's something that we've seen, that there's a lot of worries that women who are stuck at home with abusive partners, whatever the situation is, that they're at a higher risk for being abused in certain ways, not having access to the resources they need. And that happens too during hurricanes. You can imagine how chaotic that situation is. We all can. We've all probably have had to evacuate or have lived through it, or know others that have, from being here in South Florida. And lastly, I just want to bring it back to some of the recent work that we've been doing around extreme heat and clean energy work. It's been very frustrating to see what some of our community members are going through right now, given the fact that they're unemployed. There's one woman in particular that we've worked with in the past who's gone through our leadership program, who's a great woman. She's older. She has some mobility issues. She went through this effort of buying her home and was really proud to do so, but now it has to deal with the upkeep and unfortunately can't afford all the restoration that's needed on her home to have it be energy efficient. So when I think about this intersection of women's health and heat especially, she's someone I think about because right now she's running her fans. She's not running her AC because she can't afford to do so because her electric bills are too high. And those are the situations that really get me amped up and working on these issues, because that should not be the case for anyone, especially our most vulnerable people here in Miami-Dade.
Thank you so much. Sky.
Thank you. So as my colleagues on this panel have noted, heat is a significant health issue, and it's one that's growing as temperatures increase. Recognition is also increasing at the city level, the county level, but the focus has mostly been on mortality. Older people and people with pre-existing conditions are more vulnerable to dying in a heat wave or other periods of increased temperatures. But heat is also a reproductive justice issue. And if you could bring up my first slide. One reason for this, and there are many, is a link between heat and adverse birth outcomes. So this is research by Dr. Rupa Basu, who works for the EPA in California and is also an epidemiologist. And she found that an increase of 10 degrees Fahrenheit in a weekly average corresponded to an 8.6% increase in preterm birth. She later did a study looking at stillbirth and found that the risk was 10% higher with a 10 degree Fahrenheit increase. Next slide. A brand new paper came out in June. This review paper only looked at studies in the US, but found that 9 out of the 10 articles that they looked at found a significant association between exposure to heat during pregnancy and adverse birth outcomes. And they found, for example, with premature birth, a risk increase from 8.6% to 21% in one study. So these are really significant increases. Heat impacts different people differently, as people on this panel have already noted. And also, as others have noted, heat is not distributed equally. Across the US, studies have found that low-income neighborhoods, very often neighborhoods where communities of color live because of, decades, if not, actually centuries of marginalization and racism, are hotter than whiter neighborhoods. And if you think about, what we know and what Dr. Cheryl mentioned, this is not surprising. If your neighborhood has more factories, more roads, more concrete, it's going to be hotter than a wealthier, leafier neighborhood. Next slide, please. Not only are Black women in the US already dealing with more heat and often with less income in order to manage that heat, but they already have much higher rates of adverse birth outcomes. So these are numbers from the CDC. Premature birth, 50% higher for African-American women than white women. Low birth weight, more than twice as high for Black babies than for white babies. Stillbirth rate, more than twice the rate for Black women than for white women. These are very serious inequities and injustices. So our argument at Human Rights Watch and the work that we're doing is that it is necessary to see pregnancy in the context of a warming world. But this issue needs to be seen through a reproductive justice framework. And in the US, that means including racism in our analysis. The next slide, please. But just, so you can see what we're up against, these are just 3 websites that I picked out on heat illness and heat warnings: Department of Health, the CDC, the Department of Health and Human Services. Older people are mentioned, athletes, low-income households, babies, young children, athletes, and these are all very important vulnerable groups, but pregnancy is almost never included in these groups. Next slide, please. As the keynote presentation made very clear, we have a terrifying prospects of heat in the future. This is from Union of Concerned Scientists. Currently, we're experiencing 41 days that feel like 100 degrees. We'll hit 134 by mid-century and 115 even if bold action is taken. Now that's one thing if you have AC, but if you're working outside all day in the heat, that's really excruciating, brutal heat. And women farm workers and men farm workers are already working in excruciating, brutal heat. So another goal of our work in Florida, where we are interviewing pregnant farm workers right now, is to also get a heat standard for all workers, but one that is good enough and strong enough to help protect pregnant women too. Thank you.
Amazing. And with the hospitals full under quarantine with the pandemic, you know, any of these one issues, we can all envision what that means. So now we're going to what we're all here for, the solutions, because we resolve, right? We
Hey,
want to
Maria, I
Oh,
didn't get to speak on
I
City
always
of
make at
Miami.
least one big mistake every webinar. Go ahead, Alyssa, excuse me.
You knocked it out early, so now we're smooth sailing for the rest. So thank you. Everyone brought up great points. I'm going to talk a little bit about some of our more climate threats, but also just want to say that I don't see it as a surprise that we're all focusing on extreme heat. I think it's starting to become one of the more pronounced impacts of climate change that seems to be a little bit overlooked in the past and is starting to rear its head. And I think that the connections between extreme heat and women's health are a lot more pronounced than some of the other climate threats. To me, it's not surprising that we're all talking about it, and it is what I'd like to focus on. But just quickly, I want to mention that in Miami, when we talk about climate change, we talk about three major impacts. We talk about increasing flooding due to sea level rise, intensifying storms, and extreme heat. So I'm going to focus on extreme heat as well. It's a major public health threat, the #1 weather-related killer in the United States, and that threat will only continue to increase. So more people die from extreme heat than any other weather-related natural phenomenon in the United States. I also have a slide to perfect. In Miami, we already experience roughly 4 months worth of days over 90 degrees per year. That's roughly 2.5 months more than in the 1970s. And by 2080, it could be up to 5 or 6 months a year that are over 90 degrees, that feel like over 90 degrees. So that's inclusive of humidity. This is a problem for heat-related illnesses, it was touched upon before, for which children, older adults, outdoor workers, like construction workers, which is of particular interest here in the city of Miami, and low-income adults are most vulnerable. So women may fall into one or more of these categories, but they also tend to be caretakers. So, if it's not them, it's someone that's in their care. And that can just add to the burden of responsibility that women tend to carry among their families and in their communities. Another thing is that Miami has high income inequality and high rates of poverty. So many low-income residents, as discussed before, and as Myra had great anecdotes about, already struggling with their cost of living, and the necessity of air conditioning adds to that. So many of these residents are energy burdened, meaning that a disproportionate amount of their income goes towards paying energy bills. Anything over 5% of income being spent on energy bills is considered a burden, and the average in Miami is 7.5% of people's income being spent on utility bills. So, regularly that is an issue, and especially now with COVID and people experiencing loss of income, this is an even bigger threat. Another reason that extreme heat is a challenge for women's health, as mentioned in the beginning, is that warmer temperatures can mean mosquito season lasts longer, and people are more vulnerable to mosquito-carried illnesses like Zika. Miami was a global hotspot for that outbreak, and while the response was really well coordinated locally, we can see with COVID that our coordination on dealing with pandemics and diseases that don't see regional boundaries could still improve. So whether we like it or not, we are experiencing and will continue to experience the impacts of climate change, and we have to learn to adapt to these changes. Climate change, as many people have said, is a threat multiplier, meaning that it just adds a layer of complexity to the existing stresses that we experience as a community. And so for those social determinants that were mentioned by all the panelists before, the risk for women will be could be amplified. So that's just some ways that we're thinking about climate threats for City of Miami residents. Thanks.
Thank you so much, Alyssa. And now, Dr. Holder, on to the solutions.
What's really, I have a slide also, but this slide talks about learning more, and it brings me back. If you watch my TED Talk, and I hope everybody watches TED Talk because I have about 12 minutes to explain everything rather than these 2 minutes. But it's about a patient that in 2016, and if you go back to Alyssa's slide, you see one of the top days was around 2016, if you look in here. And that's when I got engaged in the climate topic, because my patient Anime showed up because she couldn't pay her FPL bill because her energy burden was tremendous. She had chronic obstructive pulmonary disease, she had asthma, and she lived in one of these old houses in Opalaka. And that made her incredibly vulnerable to the heat and worsened her asthma, used all her refills. She couldn't afford to keep buying these things. And she also just couldn't breathe. And it gets us back again to COVID, and we hear that again about breathing. When George Floyd died, it was about breathing. The heat is about breathing. And this led me to starting connecting the dots. And so I started, and what I encourage everyone is do the work, learn more about climate change. It's happening now. Try and trust the scientists, learn. Use COVID again as the example. When we ignore the science, we ignore our learning, we ignore the work that we have to do for ourselves, it makes us increasingly vulnerable to the manipulations of others and worsens our health outcome. So get working, learn more about. There are great programs like Project Drawdown. Paul Hawkins' book tells you like 100 ways you can be an expert with one book, which then prepares you to do the next step, educate. It's time to educate everyone about climate change. So when you leave here today, there has to be one message that you can take home that you've learned. And if we're all women and if we're all over 50, remember, you gotta sleep at night. That heat is killing your sleep, which is making you all stressed out. And it comes from burning too much fossil fuel. Connect all the dots for everyone, and it's time to educate everyone and start voting on it. So then we must advocate. And there are lots of organizations out there. If we do not advocate for a better world for all of us, my poor patients, my Black and brown people in all the world will continue to suffer. The suffering didn't just start in 2016, when the days started getting higher. This suffering has been ongoing for centuries. And again, this new pandemic, this of climate change, this crisis is accelerating and amplifying an already vulnerable, hurting population. We no longer try to say they're vulnerable, but they're vulnerated, that they've already been harmed by our systems and our structural issues for the hundreds of years. And unless we come together and advocate for the people who I say are prophecies that are just signaling what's coming for the rest of us, we are not going to get out of this. Time is running out and we must make those changes. So educate yourself, then start educating everyone else, and then start advocating. Thank you.
Thank you so much, Dr. Holder. And before I go to Myra, I'm going to remind everybody to please start posting your questions in the Q&A tab so we can get to them as soon as we get through this portion. Please go ahead, Myra.
Thank you. We can advance to the next slide. So one of the ways that we're trying to really address all these issues of climate, health, and inequity that we see here and that we've been talking about for almost the last hour is through the Miami Climate Health and Equity Coalition, or CHEC for short. And really the aim is to build power for a just, healthy and sustainable Miami. And so I'm happy to highlight a lot of our partners, so much are on the call, which includes CLEO for Conditions for Climate Action, the Middle Goals Society Consortium on Climate and Health, the Miami Foundation, and FIU. And what's really unique about this partnership is that you can see that we all come from different backgrounds. We have some nonprofits here, we have a foundation, we have a great institution like FIU, and then also FCCA, which includes our medical and healthcare professionals that are thinking about climate change and how they should be involved in this fight as well. And happy to say Dr. Holder's a really big part of that as well. And in this CHEC Miami group, what we're working on right now is we've been having focus groups with community members. We'll be having focus groups with healthcare professionals. And this took place after months of doing surveys and asking people, what are the climate and health impacts that you see? What are the kinds of solutions that you propose for your neighborhoods, for your communities? And so we're using all that information, all that data, and in speaking with people to come up with a policy platform and to start to think about what are the things we can implement here that are realistic for Miami. And so we're excited to have this work undergoing now, and hopefully in October we'll have a wider event that will be virtual, of course. So we'll be discussing those ideas and those solutions. And we're really looking forward to having community members, those that are impacted by these issues, to be a part of that forum and let us know what they think about what we've come up with so far. Because like, as I mentioned before, really our aim is to ensure that these are community-driven solutions, that we're doing things that you want to see and that are informed by you. So if that's something that you're really interested in, you can email me, and my email's on the slide below, and then I can definitely plug you into that work and see how you can be involved with CHECK. And next, I just want to highlight another amazing group that we're a part of. It's called the Miami Climate Alliance. And the Miami Climate Alliance is a coalition of 80 or so organizations that work on climate change issues, but from different perspectives as well. So we have labor union groups, we have direct services nonprofits like ours, we have groups like the Clio Institute that work on climate education. It's a whole mix of groups here. And there's different working groups that you can be involved in. So one that I co-chair is the Clean Energy Working Group. And some of the things we've been working on is figuring out how can we get more people aid and relief at this time for patients like Dr. Holger that she mentioned, Anna May, making sure that they're not in those situations. And clean energy is definitely part of that solution. So if that's something that you want to be a part of, you can definitely reach out to us and we'll include you in the working groups, and would love to hear your ideas and solutions to these issues. There's also a disaster resilience working group. We've been talking about hurricanes as well and flooding issues. And that's another great group to get involved with if that's something that you're really interested in and want to get involved in. Resilient Miami is working on affordable housing issues and looking at how the budget is prioritizing all of these issues. And if they're not, how can we advocate for those solutions? And we even have a digital organizing group as well, where we're coming up with great webinars and workshops to think about what organizing should look like. How can we advocate virtually now, since that looks very different than showing up in person for a county or city commission meeting. So I just really want to highlight these both initiatives because I think they're great. They're really intersectional, and they include a lot of our partners that are here on this call and outside of it as well. So thank you all, and I hope to get some emails from all of you asking to be involved.
Thank you so much, Myra. Sky.
Yeah, so in terms of addressing, I start with education as well. So, you know, we need to solve the climate problem, both in terms of ending fossil fuel reliance, but also on adaptation or getting our populations ready for the inevitable impacts. But we need to make sure that women and girls are really part of that and not like a side issue, or actually, as it is right now, basically just not seen at all. So climate justice groups need to increasingly start taking on reproductive justice as one of their issues, that these are intersectional and interlocked. At the same time, we need to see reproductive justice organizations who are already completely overwhelmed, especially under the Trump administration, with cuts to, you know, the most basic access to contraception and safe abortion care, but they also need to start taking on the climate issue as well. Education also at a very granular and specific level. Pregnant people and their families deserve to know about heat and the impact of heat and the importance of getting cool. Academics and people who have studied this have found that there's very low knowledge about the harmful impacts of pregnancy. And as Cheryl mentioned earlier, people tend to like say, oh, it's hot all the time, it's not a health issue, I'll just manage it. And getting pregnant people and reproductive justice groups at the table. So, you know, if a city like Miami is deciding what parts of Miami should have more trees, or where should we invest limited resources in terms of protecting people from heat, well, where is the birth rates the highest? Where are the adverse birth rates? Where is stillbirth, low birth weight, preterm birth already the highest? That should be included in the calculation. And currently those are normally not included. So I'll stop there, but those are just some thoughts to add to others.
Thank you so much. Alyssa.
Thank you. So when it comes to, so I'm going to talk about hurricanes and heat this time. When it comes to hurricanes, Miami has, great policies and, that kind of governance infrastructure in regards to like wind codes and how our emergency management runs their emergency operations centers and just how they monitor and respond to storms on like a government level. Where there's great opportunity for people is, and for governments, is with helping residents become more personally resilient on an individual level so they can be self-sufficient for 72 hours after a storm. So when we talk about hurricane preparedness, we talk a lot about like the 72-hour initiative, which is just how can you be self-sufficient for 3 days after a storm. If you can do that, you are in a fantastic place, on a personal level. Normally, I would advocate for people to participate in community emergency response team training, so CERT training, but those are on hold right now due to COVID because they have an in-person training component. But just to explain what they are and to advocate for people to participate in a COVID-free world, it's a free training offered by cities and counties in Miami-Dade that educates people and trains them on how to be kind of an interim first responder in their neighborhood. And people create little teams of all these volunteers that can help neighborhoods after a storm. The best thing that people can do is take hurricane season seriously. And so that's accumulating supplies slowly over a few weeks, because I know it can be financially burdensome to go out and just do a big hurricane haul. And just be prepared, because the necessity to be able to shelter in place if you're outside of an evacuation zone this year especially is more important than ever. And we're looking to have an active hurricane season. We had our first kind of storm in the early end of July, early August, and so that's something significant. And this idea of CERT training and beefing up volunteers is part of the Resilient 305, regional, countywide effort to build up the resilience of our whole community. A longer term project that the city of Miami is kind of leading on in regards to governments is resilience hubs. So we've been working with different community advocacy groups, but the idea for us is to enhance park structures so that way they can have energy redundancy through battery backup and solar panels, Wi-Fi, charging stations, so that way they can serve as convening spaces after a storm or a natural disaster, as well as cooling centers for those who don't have AC. So hopefully in a post-COVID or other pandemic-free world, when we launch these, people will be able to come to them. And that's something else that's included in the Resilient 305 strategy as well. In regards to extreme heat, Miami has had two notable recent achievements. One is that I have been working with Myra personally on a citizen science initiative called Heat Watch with a group of consultants called Kappa Strategies, where we sent out volunteers to drive different routes throughout the city of Miami to collect heat data. So that way we can develop a literal heat map of the city of Miami so we can know where it's hotter, where it's cooler, and that can help us drive our solutions and be more, educated about which areas need more attention than others. Another thing is that literally just this week, we joined the Atlantic Council Emergency Heat Resilience Initiative, Alliance rather. And part of that commitment is to help pilot an initiative to name and rank heat waves the same way that we name and rank hurricanes. So that way we can bring more attention to the extreme heat threat and just make it more present in people's minds, and they can take it more seriously for the threat that it truly is. So, kind of the thesis that I boil down to is that being aware of how climate change impacts Miami and being personally prepared to adapt to those threats is one of the best things that individuals can do to be resilient. And so if people want to learn more about how it directly ties to Miami, they can go to miamigov.com, search climate change. We have a whole climate change subsite on the city of Miami that's how Miami is vulnerable to climate change impacts, what the city is doing, and 10 things that people can do on an individual level to be prepared and to help reduce greenhouse gas emissions. Thank you.
Amazing information. I'm trying to keep my takeaways in my own brain. I'm going to refresh everybody's focus from the audience to please post your issues and solutions that we can share for later. And if you haven't yet posted your questions, there's still some time. We're going to start with the Q&A for the panel now. And I'm going to start with the first one from Scotty Turpak. As this is something that has a global impact, to what extent do you collaborate internationally? And what, in your opinion or view, would you say are the top priorities in an international setting and critical to Miami? Can I ask the panelists to just raise your hand who'd like to go to answer, to take that one? First question.
I mean, I vote for Alyssa. You probably work internationally more than some of us have. Just my guess.
Can you repeat the question? I'm sorry, I was copy and pasting a link, so I kind of missed out the question.
As an issue with global impact, what is, in your opinion, would you say are the top priorities in an international setting and critical to Miami? And do you collaborate internationally?
Oh, City of Miami definitely collaborates internationally. We're part of a number of different, working groups and different coalitions, C40 cities, the Global Commission on Adaptation, just to name two of them that are, top of mind, Atlantic Council, Adrian Arch Center for Resilience. It's got a long name, I don't remember. But we work with cities around the globe to collaborate on solutions, learn from best practices. But I really think that the number one action is coming from reducing greenhouse gas emissions. If we want to continue to make this planet habitable and, be able to adapt, we need to level off on our greenhouse gas emissions on a global level. So that way we can, know what we're dealing with, because things are changing. Even there's ties to this coronavirus that are linked to changes in the global environment. We have a loss of biodiversity. We're expanding cities so much that we're moving into natural spaces, and that can be a way that we bring new pandemics and new diseases into the human sphere. So I would just say that, curbing the rampant expansion of cities and creating a society that is more carbon neutral or carbon zero, net zero is very important. So that comes down to the goals stated in the Paris Climate Accords. And while we may not have national guidance on that right now, major cities like Miami, New York, Los Angeles, Chicago, all these cities can take major steps towards those more climate friendly policies. And that can be very, very impactful on a global level.
Yeah, I agree. Health-wise, also reducing greenhouse emissions is key. We have got to take that into account as the first thing, because as the emissions, that also triggers the heat, that triggers the pollution, which then causes all the different health impacts. So it all comes back to greenhouse gases, and that must be acted on immediately. We're facing, because of the heat and the changes in the planet and the rainfalls, we're looking at droughts across the world, which is pushing the mass migration. So it's not just the physical and the physiologic changes, but we may be looking at total global disruption, which may lead to more wars and more problems to our planet. So we do have to think global as much as we do local. And most of the health professions in climate world, we work together. We may have our small organizations, but they're larger groups that's connected to bring the awareness that our health is being impacted now, and we have to mitigate, and we do have to act immediately on greenhouse gases.
And Terry, go ahead. Guy, did you want to say something?
I mean, I'll be very quick because it's hard to talk about the whole world, though of course this is a whole world problem. But feminist policies, I mean, think about across the continent of Africa, how many women are going out to work in the heat all day in order to grow enough food to keep their families alive. Same in Southeast Asia. And if you look at the amount of heat predicted in those two areas, it's like catastrophic amounts of heat, and even more than in the southeast of the US, which is a lot of heat there too. So feminist policies and also anti-poverty policies. A recent paper just came out, I'll try and cut and paste it now, that looked at the difference in deaths from heat if we carry on the current inequality in the world, and if we improve or reduce inequality in the world. And we're talking about millions of deaths, the difference between the two. That's all.
And I just want to add that, you know, that we need structural change in the way that we produce energy, and that has to come, the US has to be a leader in that. So we need to elect federal officials that will move that forward.
Thank you so much, Dr. Clement. Dr. Holder, this next question is for you. Can you elaborate, this physician, Dr. Catherine Villano is asking, if you can elaborate a little bit more on the data and the links between obesity and health outcomes with extreme heat?
Yeah, what happens with obesity, because of the body mass, it's not that it's XY chromosome, it's about just total body mass ratio. And obesity has decreased flow already all the way out to the skin. So to maintain the heat temperature and to cause the proper amount of sweating to keep yourself cooler, that's already diminished. Then the extra fat, as we can put on a down coat, you know, that keeps even warmer. So you have the decrease in flow, so there's less sweating, and then you have the increase in fat. So that increases your likelihood of more dehydration and more of we have a list of happens. You get the prickly heat, and you get a little sweating, you get the heat, and you get the total increase in total body temperature. So that's how obesity then impacts you. Another issue with obesity is that fat itself stores a lot of these foreign particles that you have. So if you're having increased exposure to particulate matter and toxins, that often gets stored in fat. So we are seeing increases in the cancer rates with obesity. And that could be, again, higher storage of all the toxins that come from when we burn fossil fuel, from all the things that we do in our environment, the plastics and all that. So that's how obesity is linked, because of the fat itself.
Thank you so much. And this one for you first, Myra, please. Debbie Bussell asks, are there any best practices in public education and behavioral and cultural change in this pandemic that might translate to climate change, public awareness, or education efforts? Are we learning anything from behavioral shifts happening with COVID that could be reinforced for climate change?
That's such a good question and such a timely question with everything that's happening. I think there are a few things that I picked up on. I mean, I think inherently with the coronavirus, in order for us to get through it all, we have to work collectively. We have to not be selfish in our approach with this pandemic. We all have to be in this together in order for us to be able to get the cases down, to diminish the amount of infections that we're seeing. And I think that translates to climate change as well. I think, you know, part of the issues that we do face, especially here in the US, is that people do tend to act very selfishly when it comes to climate change issues, and don't necessarily think about how what they're doing today may impact others in the future. So for me, there's like a very tangible thread that we can start to pull more in the fact that we do have to work on these issues collectively. It's great to take individual action, but when we're thinking about who the main actors are that are leading to such big emissions, it comes down to not that many companies that are the big polluters when we're talking about oil, gas, and coal in the world. So yes, individual action is really important, but it's also important to think about how much power there is in numbers and being advocates and joining in together for movements such as this. And I think it also ties to what we've been seeing with the Black Lives Matter movement. I think, you know, amidst the pandemic and everything that's been happening, I think something I keep finding myself saying is that the same people we keep talking about that have been made vulnerable by you know, our systemic and issues with racism, we're talking about the same people, and we're talking about who is being impacted most by COVID, who's being impacted the most by climate change. So I think we have to keep reminding people of that it's not a coincidence. It comes down to how our systems were created in such unequal and uneven manners, and were made to purposely put people of color down and lower income people down, indigenous people down. So I think, to me, that's something that we can't let go of, and it's not a coincidence, and we have to keep educating people about that and connecting the dots. That's definitely something I'm going to keep doing as someone who's in this field right now.
Thank you. Can I bring up one area that we see which is positive, and it's with pregnancy. The worldwide rate of preterm births have declined since we have gone on shutdown. And this brings up huge policy, especially in America, where there's really no maternity leave fully. And it shows that our women are working too hard during pregnancy and having too much exposure to heat, having just too much work. And for years, we've done research to say, why do we have premature babies? Now we look at this pandemic, I think we have to look at our policies. We must get maternity leave earlier, and we have to get our women rested earlier. And I think if we do anything that comes out of this is protect the woman more during pregnancy, and again, after, with all the structural issues that we have to change.
That is incredibly powerful, incredibly powerful. I'm sure I'm not the only one with chills. Amazing statistics, and it will affect every single person who's listening here today. Dr. Holder, thank you so much. So we have a question from somebody who's ready to act. Please remember that our audience is full of people who do go out and impact their community, and please make your answers count. So what are some legislative solutions, specifically local or state, that center on women? So many different perspectives on this webinar, and so excited to hear a wide array of opportunities. So please, who would like to begin? Just raise your hand. Sky.
So in the US, California and Washington State and the US military all have requirements, in the case of California and Washington, legal standards passed by the state legislature that mean that workers, people who work all day outside in the heat, are protected. They must have training. They must have supervisors who know about the heat. There must be an emergency protocol if someone begins to feel the symptoms of heat illness. And also in those legislation, they also have, for example, at a certain temperature, there are requirements in terms of how much water, rest, and shade workers must have. In Florida state, there's none of this. There's basically no protection except for a very vague general duty clause for workers who are exerting themselves outside in huge heat. Now, because of COVID, often with respirators on, which just adds to how much heat they experience. And of course, farm workers who work with pesticides are well used to working with these respirators in the heat. So come next legislative session in Florida, the legislature must pass a heat standard. And this is something that comes out from farm worker groups, from reproductive groups, from others who are unions, labor unions, who are fighting for like a basic decent standard of work, which is a really basic internationally recognized human right, and is one that the state of Florida and most of the US is failing at this point.
Thank you so much. Dr. Holder, I believe you had your hand raised.
Yeah, I know Myra has to it. The heat, it's again heat. Dade County doesn't declare heat an emergency. So then your funding doesn't flow. So when my patients have heat issues, there's really no pot of money to help them because it's not an emergency and there's really nothing they can do. So heat standards for the workers, because I work with folks in the field and that is real. My average folks in Liberty City, Little Haiti, without anything, there's nothing they can do. There's some minimal weatherization. And in Palm Beach County, they're still burning sugar when we have green harvesting, and that particulate matter, which then worsens your COVID response. And we have a way that you could make jobs and decrease the burning, and yet they continue to burn the cane, which then worsens our entire overall health in Florida. So Florida locally has a lot of issues, but I think accepting that heat will be an emergency so the funds can flow is a huge step that we have to take. And energy efficiency, getting Florida Power and Light and everyone together to make, that's the low-hanging fruit. We can make some changes in energy efficiency and save a whole lot of money and decrease that 7.1% under 5, so my patients can afford to eat and to buy their medications. So there's some huge things that we could do immediately.
Amazing. Amy, I think you were next.
Yeah, I just want to add to this excellent point about heat alerts. So we've been doing some work with Alyssa and Myra, also looking at heat within the city of Miami, and mentioned a citizen science project where we have people that go out and actually place thermal thermometers basically throughout the city. And what we see is not surprising, which is that there are pretty significant differences in heat across the city. But when you compare that to the weather station data on which the alerts are based, they are way underestimating the heat impacts in the city. And if you add humidity to that, then you would have a number of heat alerts that are just completely missed by using weather station data from the National Weather Service. So I think that there's a movement now to recognize that these kind of hyperlocal metrics of heat need to be incorporated into the alert systems, which then actually trigger policy outcomes like Dr. Holder was mentioning.
Fantastic.
Can I say something really quick,
Yes,
Maria?
Yes,
Thank
please.
you. So definitely echoing what everyone said, and Dr. Holder mentioned a few things that I wanted to touch upon. One being that, you know, people can advocate for their local municipalities as well as Florida Power and Light to help people finance energy efficiency retrofits for their home. So that way they can not be energy burdened. That's a service that they do provide. And it can be encouraged that they devote even more money to that. So that's one thing that people can advocate for. The other thing being, as I mentioned before, City of Miami is going to be piloting an initiative to name and rank heat waves. So please hold us accountable. You know, if you see in a few months or in a year that this has not happened, please bring it up to the local elected officials in City of Miami and say, this is a priority for our community because it can save lives. And then two other kind of more basic things. One is to advocate for planting and maintaining trees. It's a natural way for communities to create shade and create natural cooling. I could tell even anecdotally, going through the city, driving to collect data, that the places that have those beautification projects, more trees, are multiple degrees cooler than those that don't. So that's just an easy, simple way. You know, you don't have to overthink it to create cool in our neighborhoods. And then lastly, in the state of Florida, that we have a mandate for assisted living facilities to have generators that are maintained. So that way we don't have a situation like we did in Hollywood where people are just dying because of just heat, you know, something very preventable. So making sure that our cities have enough budget to be not only checking in on those assisted living facilities, but to help them finance it if they do need help purchasing a generator, because they can be quite expensive. But that's something that's very simple, you know, a capital cost that can save literal lives. You know, we lost 14 lives, was it 2 summers ago, just because of extreme heat for something super, super preventable.
Do we have time for me to add something too?
Yes, I was just going to ask. I was sure you'd have something to add. Please do.
Yeah, I mean, I think I love what everyone has said. I definitely agree with all the solutions and policy-related solutions that we've proposed. I mean, something that I just want to bring attention to is the fact that through the Miami Climate Alliance with the Clean Energy Working Group that we mentioned, that's the fight that we've been having with FPL right now, is to ensure that we have more funding for energy efficiency programs, that people right now I mean, we know that within the FPL territory that 250,000 people are behind on their bills right now. So that means that at any point, if FPL were to decide to continue shutoffs, we would have a lot of people that are in dire circumstances that wouldn't be able to turn on their AC at this time. We're in the middle of a hurricane season, in the middle of a pandemic. That would be the worst time to absolutely do something like that. So that's something that we're doing. We're holding them accountable and making sure that they do right by people right now, because this is the worst time to take that sort of action. And just we'll quickly add that we're also, we're coming together right now with our working group members to figure out what a clean energy future looks like for Miami-Dade County, and coming up with ideas for how we can get to that 100% renewable energy future here. So if that's something that really gets you going, or really amped up about it, this would be the perfect time to join us. And I'll add the email that you can reach out to in order to be added to our work. But I think it's super important for us to curb emissions. We have to get to a clean energy future. And if we can ensure that everyone has access to it, not just a certain few, then that's how we'll really make sure that people like Anime, the woman that I mentioned earlier, that they are in the best position possible to adapt to climate change impacts.
In these last couple of minutes that we have for the Q&A portion, I'm going to combine some different comments and questions that we're getting. I think there's a real cry here from the audience of one, understanding how complex issues like these need to get addressed by complex solutions and collaborative solutions. So specifically, when you're talking about the heat standard to protect farm workers and construction workers, who all is involved, who all has to agree and be woke to be able to ensure that this happens. Who'd like to take that? Sky.
In 2 words, the legislators. So the people who represent you in Tallahassee. And then of course it flows down from there. But right now, Florida is in a situation where, big business and big growers are getting what they want. And, the poorest, the low income farm workers who are, already face multiple layers of vulnerability are not being adequately represented and their health needs not met.
Lisa.
Go online for almost all your legislators, and that's where education come in and asking the key questions. You can ask them, what are their policies? What do they know about greenhouse gases? What do they know about climate change? And if no one says that we have to reduce greenhouse gases and we can mitigate our way out of it, that means make some little tweaks, you do not have the person who understands the science. So you have to take it all the way to the root cause and the policy change, because there are a lot of politicians who will tell you, oh, we can do this, 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 and it'll make a difference. Maybe for today, for one person, but if we're going to get at the real issue, we need politicians who respect and understand the science. And we won't have the pandemic, what happened with COVID, where we saw what happened, where a simple scientific concept of mask wearing became politicized rather than remaining in the health arena. And we lost a lot of lives. So we want not those lives to be lost in vain, but that we use that to learn and challenge our politicians and move beyond, if it's going to benefit me short-term economically, I'm going to support that candidate, because there are too many lives lost when we continue to make these short-term economic things. You remember your children, your grandchildren, and we are living longer. So this is not just for the future and you'll be dead, but most of us will be here longer, God willing. And so you do have to ask the tough questions and hold them accountable. It's not difficult. It really isn't rocket science. It can be done. And you know the politicians that have been doing the talk for many, many years, and they should be, as the kids say, they should be canceled.
Thank you, Alyssa, and then Amy.
Yeah, so I wanted to call out some names and entities that would be the right people to bother, as Sky and Dr. Holder were saying. So on a state of Florida level, of course, the governor, DeSantis, he makes the policies for that impact all of the farm workers and construction workers in the state of Florida. So that would be one person. Nikki Freed, who runs the Division of Agriculture. I'm sure that she has impact on the labor rights of the outdoor workers. On a local level, our mayor of Miami-Dade County, that's up for election right now. So if this is something that's interest for you, make sure that you do your research on your candidate that you choose. So that way they're in alignment on the type of person who would support this kind of policy. The policy itself in regards to like heat alerts and heat thresholds for just public awareness would probably be set by the division or the Office of Emergency Management. So being sure to include them in your talking points and making sure that they're the type of people, they're the practitioners, they're the one who would actually implement a declaration and things like that. And then lastly, on a national level, you know, workers' rights, especially for these outdoor workers, comes from OSHA, OSHA. So that would be hopefully something in the long term that these heat requirements and thresholds are integrated into OSHA requirements. So that's a way that we can keep these workers safe.
Fantastic. Amy.
I was trying to unmute myself. Yeah, I want to echo that. Also, I mentioned in our Climate Resilience Committee is an opportunity to hold our city government accountable. And we have had a really great display of support from the community this Monday, where we had over 50 different individual public comments on a particular issue related to resilience and support of resilience efforts in the city. And we had the mayor and the city manager responding quickly, having seen that public comment. So I can tell you that if you're engaged in that way and you comment publicly, whether it's the city commission or our meetings of the Climate Resilience Committee, you will be heard.
So I'd like to say, Dr. Clement, that as the Women's Fund, we would like to participate the next time. I think what we can do is we can come and bring a summary and a synthesis of all the engagement and some of the information that we got today. These impact collaboratives live on and they are shared. This is all being recorded and it lives on our website. Many people can't come, of course, during the working day, and they see it later. So this is representing many people in our community, and Women's Fund will coordinate with you on a sidebar, because we'd like to take everything that everybody in the audience has been asking, the concerns that have been shared, resources that have been shared, and bring it in the big, powerful W of Women's Fund. Myra, did you have something that you wanted to add to this end before we?
Yes, I just typed this into the chat box, but I wanted to also bring attention to the Public Service Commission. So when we're thinking about utilities and who regulates them and who has some sway over them, the Public Service Commission for Florida, that's a really important entity that a lot of people don't know how much power they have. They look, they have power over electric utilities or water utilities, also some other water related things. So they're a powerful entity. You should also be paying attention to them. Oftentimes they go under the radar, but they really shouldn't, because they can also ask our utilities to do right by us. And yeah, I just wanted to echo what's been said about voting for the upcoming primaries. I think that's super important. It's great, of course, like we need federal leadership for all of this. We need statewide leadership, but it's also important to bring, to ensure that we have the right local leaders in place. So with our county mayor seat being up, and also more than half of our county commission seats being up for re-election, if we can get the right people who care about these issues in those seats, and that makes a huge difference. And I'll just point out that the Miami Climate Alliance actually did hold a mayoral forum yesterday where we did focus specifically on issues of climate change and resilience. We talked about the Black Lives Matter movement and social justice issues. So if you didn't get to see that yesterday, I'm sure it'll be up on their website, miamiclimatealliance.org. .com, and you'll be able to see what some of your candidates had to say about these issues.
Miami has an opportunity to lead. We are Star Trek. We're going on ahead. I'm going to look at the next slide, please, and highlight the amazing Clio Institute. Please see in the chat all of these resources, because the opportunity does lie in empowering women and girls to be more resilient and strengthen their leadership in their communities. This institute, the amazing Clio Institute, has empowering resilient women and girls, the power of we. It's a program for women and adolescent girls from underserved communities to connect the dots between climate change, health risks, economy, and emergency preparedness. So this does not end here. We're informed, we're engaged, we're connected, and we have places to go. So you all said it, let's say it again. Vote, vote, vote. Primary elections, August 18th. If you're mailing in your ballot like I am, it has to be stamped before the 18th. Why don't you mail it today? And your feedback honestly matters. And if you leave us a quotable quote on our very brief survey, then we can show people what we're doing. It's really important that we be powerful as an organization that works with women and girls. This focus and this lens is important. If you think it is, please, survey will take you 2 minutes max. And our next Impact Collaborative, always the first Thursday of each month, is human trafficking, cybersecurity, and COVID-19. All these issues are interrelated, as we know, is a public health issue, and the business changes of human trafficking, the business changes of labor trafficking, and we need, as a community, each individual to keep up with it. So we thank you for joining us today and always. Stay strong and stay healthy, and stay connected. Thank you so much. Thank you, panelists. You're amazing.
Thank you.